Good afternoon, folks. Welcome to another episode of the Anxious Podcast. And today's episode is a little bit special because it's based on a little feedback that we got from a bunch of users on a piece of content that we put out lately. And what was it? Well, basically, we talked about how unknowingly your physician or your doctor might be causing health anxiety. And sometimes they would even exacerbate it unknowingly. And when I say physician, I mean your doctor, uh, your general practitioner, your GP, your specialist. I'm not talking psychologist or psychiatrist. They don't really concern themselves about your health anxiety because that's not their job. Their job is to figure out if there's something wrong with you and give you accurate diagnosis and advice. Now, what ends up happening is you might have noticed this yourself is they might give you an advice like, hey, your lymph node was swollen, but it seems like there's no cause of concern. If it, grows larger, come back. Or if it's doing this, come back. Or if it's doing that, come back. That advice is reasonable, right? And sometimes it's mostly, or sometimes it's also like, for example, I had a urologist who gave me an advice, and he said, "Well, what you have does not look like cancer, and it's 95% chance it's not cancer, right?" So when he said that, and it's like, okay, well, I can write you an ultrasound if you want, and he did an ultrasound, and the results came back, and the specialists say, yeah, it doesn't appear to be cancer. We're 99% sure it's not cancer, so don't worry about it, right? But my mind was not focusing on that 90%, that 99%, right? My mind wanted absolute certainty. So I was focused on that 1%, that 10%, right? And as you know, that is just not reasonable, right? We need to think in probabilities. And that's just how life works. You just have to rely on probabilities. So when you get advice like this, and you have hypochondria and you have health anxiety, you're more likely to, screw yourself over by, chasing uncertainty. It's not your fault. It's just something happens automatically. It's out of our control especially if you're a hypochondriac. So a lot of times these doctors have to do a better job of communicating in a way that doesn't trigger somebody's anxiety, right? But at the same time, expecting a patient to have absolute certainty is not reasonable from their point of view. They will never tell you something with 100% certainty because, they don't want to get sued for medical malpractice when, it turns out they're wrong and, you end up suing them. So they don't want to do that, or at least, it might jack up their, insurance. And it's just like, yeah, unreasonable from their perspective, right? So I think um, the medical practitioners, especially people like, GP and your specialists, need to have a better training on how to communicate with people in a way that doesn't trigger somebody's anxiety. Or if they notice that there's a pattern of anxiety in a particular person, they should figure out a way of, helping people with their anxiety instead of constantly reassuring them. Because, if you have to go to a doctor, like say 5 times a month or something that is, like something that isn't a cause of concern, that wastes a lot of their time and it also wastes a lot of resources. If you're in a country where, they have like universal health care. And more than that, your insurance might not pay for that because they might deem that as medically unnecessary. So you might be drilling a hole in your pocket. So I think the doctors and specialists have to do a better job at this. and they can refer people to, say, a psychologist for counseling about something, or, if counseling is not available or therapy is not available or the patient can't afford it, they can refer them to people like us, where we treat people with like alternative methods. We're using quick calm and mindfulness and things of those nature. And I think it's better for patients. And it's like, for example, I'll give you um I knew this girl, and she had hypochondria, and she would go to a neurologist. She was in a country where you could just go ahead and see a specialist. I'm not going to mention the country, but you could see a specialist anytime you want, right? And there are a lot of countries where you can actually do that. For example, in Thailand, you can go see a specialist like tomorrow if you want. So she, goes to this neurologist, and that this guy would just write her a test or whatever she wants, right? So he gave her a vague advice like, yeah, it doesn't look like you're having seizures. It seems like your sleep issues are fine, but if it's getting worse, come back, right? And of course, she didn't took that advice. Yeah, I mean, he should have done a better job of providing proper advice. So she would have like bad nights of sleep or some stress, and she would freak out, like, oh my God, is this something it? Am I, having this disorder or that disorder? And she would like go to this neurologist, and this guy would just ends up prescribing her very, very expensive tests like MRIs. So she had close to 5 or 6 MRIs in 1 year, and she racked up the bill of like around 13,000. Again, she's from a country where it's not that expensive. And again, of course, insurance is not going to pay for that. So she had to pay a lot of that out of her own pocket. And it ended up causing significant amount of financial distress for her. So that's the kind of damage that a lot of these doctors can do if they're not trained when it comes to dealing with people with hypochondria, right? So yeah, the I would say, um, so how do you deal with this? If you have hypochondria and you're suspicious, you're more likely to take you're more suspectable suspicible for um for something like this. Like, what do you do? Well, Quick Calm can help. Quick Calm is an app that we've developed. I'll leave the link somewhere on this page, but if you are from somewhere else, then the name is quickcalm.app. But it has these tools called worry postponement. So if you're worried about something, right? Something that is not like significant, like for example, it's like a new symptom, or something that's like an old symptom. You've already talked about this with a doctor. Then you can use a feature we have called worry postponement. If you don't have QuickCalm, you can still do that yourself on a notebook or like on a timer, or you can set an alarm. But the idea is you postpone your worry for a few hours, and you go out and look at your worry at a particular time every day. So 7:30 p.m. or 8 p.m., whatever works for you, for 10 minutes, no more, no less. You'll just, meditate on your worry and you'll deal with it, right? You'll create an action item. Okay, this is exactly what I'm going to do about this. And when you do that, sometimes when you introduce a little bit of delay, you first of all, you're teaching your mind that this is not significant. Or, sorry, not significant. This is not like something that is urgent. I've already taken care of it, so you can chill it or you can relax, right? Chill. And when you do that, uh, you will notice an instant relief in your anxiety levels. Oops, sorry, what happened there? So you will notice an instant relief in your anxiety level. Try this exercise. Do it seriously. But it's also important that when you're postponing your worry, you have to promise to yourself that, okay, I'm not going to ruminate about this. Now, of course, easier said than done. I would recommend you can distract yourself by focusing on something else. And that could be doing an exercise. That could be reading a really good book, something that's very engaging, playing a video game, talking to somebody, going out for a walk, um, going shopping, right? When you do these things, you distract yourself until you reach that time where you can finally deal with your worry, right? And it's a very powerful exercise. So I'd recommend that you give it a try. You can download the app, or there's a web version, which is significantly better because it has templates. So I'd recommend checking out the web version on quickcom.app. And, again, if you don't have QuickCom, because it's a paid app, I don't want to make a free app because people don't really use it. And also, we have to pay the developers. Um, but you don't really need the app. You can just do that by setting an alarm, right? App is just like, nice interface to have or whatever. So that's what I'm trying. That's what I wanted to talk about in the. So that's what I wanted to talk about in this podcast episode. So I'm recording this right now from a coffee shop, which is exactly why I sound a little bit weird, and it has been quite some time since I've recorded a podcast, so I'm not going to be perfect. There's going to be a bunch of mistakes in here, and I'm too lazy to edit it, but it's better to ship it than, to be lazy about it. So that's what I wanted to do. All right. So I think that is a digestible concept, I guess, right? So uh, have you ever been to a doctor who has caused or exacerbated your anxiety? Have you ever been to a doctor about, you know, um, for seeking reassurance about something else, right? If you have, this exercise might really help you, and it might also help if you just communicate with your doctor about your hypochondria. Just tell him that. And again, I know that some of you guys might be, some of you girls, judging by the audience numbers, um, you might be worried that he might dismiss your future concerns as anxiety, and you don't really want him to do that. But telling him that would allow him to provide you better care because he knows exactly what is a new symptom, what is something that he has already dealt with. And if, there's a change here that cannot be explained by general hypochondria, he could treat you better, right? And again, you can always see another doctor or get a second opinion. So, yeah. Okay. So I think that is more than enough. I don't want to, drag this episode into like one of those 30-40 minute episodes because I really want you to walk away from this episode with something that you can digest and some action items. That's something that you can do. So try that exercise, and I'll see you in the next one. Take care.